Lagos is not blessed with mineral wealth. We don't have oil, we don't have diamonds or gold, but we have people. And the new economy is the knowledge economy. So when you think about it, Nigeria and many countries in Africa are heavily reliant on imported medical consumables, drugs, pharmaceuticals, devices, vaccines, even basic commodities like personal protective equipment, sanitizers. A lot of this is imported into Nigeria. And for us in Lagos, this poses a real challenge. It became quite evident during COVID that the moment there was a shock to the system and there was a sudden increase in the demand for consumables and medical appliances, the forces of supply and demand and cost immediately kicked in.
When a Nigerian travels abroad for oncology or for cardiac care or just for their annual checkup, the payment for the procedure, the flights, the accommodation, and the months of support all flow into another country's economy.
Another challenge on the continent of Africa, another massive outbreak of Ebola in Central and East Africa. There's always a chance that these outbreaks will reach Nigeria, Lagos, West Africa. And again, we'll be left scrambling for consumables, scrambling for the appropriate level of personal protective equipment, scrambling for drugs, scrambling for vaccines. First of all, we don't want any Lagosian leaving Lagos to access any level of healthcare delivery, whether it's a sophisticated brain operation or a cardiac procedure or cancer or a joint replacement. We want our citizens to know that no matter what's wrong with them, the solution is here in Lagos, in Nigeria. Simple comparator is cocoa and chocolate. So we grow the cocoa in Nigeria, we harvest it, we bag it, and we ship it out. And then we import exotic chocolates and beverages back to Nigeria at humongous cost to us. So if we apply this same principle to medical science, or any science for that matter, the raw material is here with us in Nigeria. The minds to translate that raw material into knowledge and discovery are here. What is lacking is the resources, the institutions, and the political will.
What is structurally different about LASMIIZO is that the foundations exist before the announcement. Lagos has often had ambition, and what is in place now is different in kind. The Lagos State Biobank is operational. The Smart Health Information Platform is deployed. The Infectious Disease Research Institute has broken ground. The Free Zone and Deep Sea Port are functioning. There is a 25-year concession and a feasibility study on the way to ground every decision in evidence. We are building on solid ground that already exists. That is a structural difference.
Healthcare and commerce rarely write a single proposal to Mr. Governor. Yet, LASMIIZO only makes sense as a joint venture between the two ministries. Health brought the clinical assets, the data, the biobank, and the regulatory understanding. Commerce Ministry brings investment promotion, trade structuring, incentive, and the free trade zone relationship. That joint ownership matters because LASMIIZO needs both engines running permanently. Mr. Governor showed that the state can govern across silos.
20, 30 years ago, we were the great consumers of international global culture and music. Every piece of music that we listened to was imported into into Nigeria until we made a deliberate effort to stimulate our own industry around culture and creativity. And now, Lagos, Nigeria, is a global phenomenon around Afrobeats, around culture, around creativity. So there's no difference, whether it's in the arts and culture, whether it's in engineering, architecture, in health, we can do the same thing. Africa is the cradle of humanity. If you want to find any genetic signature, you need to come to Africa, especially the West and Central Africa belt. And so in Nigeria, we have this huge genomic diversity. And so that makes Lagos a unique location for medical research, a unique location for clinical trials.
LASMIIZO is fundamentally investable. The fundamentals are strong. There's significant unmet healthcare demand in Nigeria and in Lagos. There's heavy dependence on pharmaceutical importation. There is a large clinical market in Lagos and existing infrastructure within the free zone and clear government backing through a long-term concession framework. The opportunity is real. In my opinion, the most undervalued asset is the data infrastructure. Lagos generates millions of patient interactions annually, supported by primary healthcare centers, a growing biobank, and integrated health information systems. That ecosystem creates long-term advantages in research, clinical trials, drug development, and biotech innovation.
The employment opportunity runs through the entire value chain, and that is what makes it so powerful. At the top, we create demand for scientists, researchers, pharmacists, and biomedical engineers. Manufacturing, after all, brings technicians, quality assurance specialists, and plant operators. Logistics and the supply chain create jobs in warehousing, cold chain, transport, and port operations. So the opportunity reaches from the laboratory bench to the factory floor, to the loading dock, and beyond. LASMIIZO creates dignified work at every level.
The Lekki Corridor succeeds because its operators complement one another. Lagos Free Zone provides world-class industrial infrastructure and port access, while other developments along the axis contribute additional industrial capacity, logistics, and scale. Together, they create an integral ecosystem where businesses can seamlessly import raw materials, access talents and services, and export finished products through a connected network. Lekki Worldwide Investment Limited coordinates this relationship to ensure the corridor functions as one powerful ecosystem rather than isolated developments. This network effect gives LASMIIZO significant competitive advantage and positions it as a part of a larger regional growth engine.
The live-work community is easy to overlook, and it is essential to the long-term success of the zone. A medical innovation cluster runs on people, the scientists, engineers, clinicians, and technicians who do the work. If they cannot live well near the zone with good housing, schools, healthcare, and amenities for their families, they'll take their talents to cities that will house them properly. People are the assets that makes everything else function.
We're moving out of the era of minerals and fossil fuel. It's all around intelligence.
If you know you're wise for Lagos, you know you're wise for anywhere.
LASMIIZO is a whole network of information feeding into a central location. So there are going to be several LASMIIZO hubs all over Lagos feeding into the central location because it's like, a refinery where you have sources of oil coming from different wells to be purified and converted into products that's useful. And so LASMIIZO is just the refinery and the produce of knowledge and benefit to society is what comes out of the refinery. And that has tremendous economic value. But it all comes from the society. It comes from our institutions. It comes from our doctors, our healthcare professionals. It comes from our academics. It comes from inquiring minds who are looking to solve local problems with local solutions.
When LASMIIZO is fully operational, with the plants running, the labs, leads, and medicines made in Lagos shipping across the continent, it will mean that the long-held vision became something you can touch. For me, the meaning is in the delivery. Our role was always to support others in bringing this to ground. So seeing it function will be the proof that the support mattered.
Never before have two ministries ever come together. And this project has been in the offing for over 6 years within healthcare. And I'm delighted that under my leadership and under Mr. Governor's leadership, it will mean a great deal to see LASMIIZO fully realized. To stand one day in a zone where Nigerian scientists are discovering, Nigerian workers are manufacturing, and Nigerian patients are being treated with medicines made here in Lagos, Nigeria.
LASMIIZO will be born in Lagos. Lagos is the center of excellence. This is Lagos, Eko Nibaje. The starting block of human capital is good health. And we promise you that we will play our part in ensuring that Lagos has the human capital that it requires to be nationally, regionally, continentally, and internationally competitive for a better Lagos. Thank you very much.